Bethlem, the institute where the insane lived. Although it was originally started to help the poor, Bethlem would become famous for taking in the mentally ill. Its legacy of cruel and inhumane treatment of their patients is still remembered today, despite the leaps and bounds towards the better treatment of the mentally ill. Started in 1247, Bethlem was first located at Bishopgate, which is now the Liverpool Street Station. During the 1300s, there were only two main categories in which a doctor classified a mentally ill person. You were either melancholy mad or raving mad. Melancholy madness gave some understanding from Galen, who created the four humors: blood, yellow bile, black bile, and phlegm. He believed that each humor corresponded with a season and a temperament. Blood is spring, which equals courage. Yellow bile represents summer, which is bad temper. Black bile is autumn, which is despondent and irritable. And phlegm is winter, which means calm. Through bad habits and bad diets, a person can build an excess of one of those humors and become insane. They can suffer from hallucinations, wrath, reaping, illusions, and delusions. This could be the reason why bloodletting, emetics, and purging were so popular. This was their way of getting rid of the surplus humor. Raving madness, or mania, is when a person has an unusual irritable mood or energy levels. It means to be mad, to rage, to be furious. People also believe that madness will show itself as being a form of punishment for immoral living. Not only was the diagnosis of the ill primitive, but so were the treatment methods and living conditions. Within Bethlem, bloodletting, emetics, and purging remained popular, even when other asylums began to use new techniques and therapies. Chaining patients to beds and floors were also deemed necessary at Bethlem's second location at Moorfield. The living conditions were coded in order to sedate patients and to keep their brains from overheating. While Bethlem was at its third location, now the Imperial War Museum, it was being ran by the Monroe family. The Monroe family, in charge of Bethlem from 1728 to 1852, believed in the like father, like son method. This meant whatever technique the father used in treating patients will be passed on to the son, no matter how outdated, instead of exploring new techniques. It was under this family where hot and cold baths were being used to calm patients. Sedatives were also used. It will often mask the symptoms of the patients. However, in some cases, if medication failed, doctors would use more management, like in the case of Emma Riches. In the early 1900s, only 22 mental disorders existed, but in the 2000 DSM, there are 297. The number of treatments also increased during this time period. Today, Bethlem has many different techniques in curing those who seek treatment from this facility. One way Bethlem has gotten patients to express themselves is through art. While visiting Bethlem, you can see artwork done by patients suffering from depression, obsessive-compulsive disorder, anorexia, and schizophrenia. Most of the past treatments used in Bethlem are still shrouded in mystery. In the patient intake books, rarely did the doctors write down the treatments they used in order to cure their patients. However, what we do know is that the treatments used today are a major improvement. Instead of chaining a manic, or what you may call a person with bipolar disease, to the bed and giving them a cold water treatment to sedate them, they can be given mood-stabilizing medication, psychotherapy, and support. Instead of purging a melancholy mad person or someone suffering from depression, they can be placed on antidepressant medication, attend therapy, or if severe enough, have an ECT therapy. The ever-growing list of therapies, such as psychoanalysis, humanistic, behavioral, and cognitive, has helped the clients attending Bethlem rather than hoping the mental illness pass in 12 months' time. By understanding what the doctors did wrong in the past, we know that we will not repeat them in the future.